Well, when you think about pride and passion with anesthesia, I can't help but think of all the excitement we all had when we started as a resident. There was just so much passion, there was a little bit of fear, there was all of that as you were trying to understand what was happening and how to do it better. And with time, you got pride in how good your skill set became and how much more confident and more secure you were in a job that had a lot at stake. And then you go out and you start working and you start getting beset by all the other challenges that no one talks about when you're a resident. And what we're seeing now is that people are losing their passion because they're facing the monetary pressures from decreasing reimbursement from the government, decreasing reimbursement from the payers, a challenge of finding other good people to work with. And we're trying to find a way to have people to feel like they can really focus on what gives them pride and satisfaction and passion in the field. We get distracted from being able to take care of our patients when we're worried about how are we covering such and such shifts, or we're getting asked to cover more and more at nighttime, or more and more on the weekends, or later in the day. They talk about work-life balance. There's no work-life balance. It just ends up being work and people demanding more and more. And you're saying, I'm having a hard time meeting these demands. So Symmetry, the name comes from trying to align the interests of the patients, the surgeons, of the hospital, and our people. And we're trying to align the interests in the following way. We're going to be aligned with healthcare systems and use their strength in the marketplace to optimize our ability to obtain the best potential managed care rates that can be achieved. Clinicians are going to be leading the way in optimizing how do we most effectively run the entire perioperative space, from the pre-op to what we're doing in the operating room to what we're doing in the recovery room. I think we need to be thoughtful, methodical about it, and always checking back and saying, okay, are we really doing what we set out to do? And I think if we keep going back to our core values on that, then we'll do fine.